You twist your ankle, walk into the ER, get a bandage and an x-ray, then walk out with a $6,000 bill. No surgery, no hospital stay, just a band-aid and some Tylenol. Why? Why does something that simple cost more than a month's rent? Let's start with the bill itself. You're not just paying for care, you're paying for how hospitals charge for care. Hospitals use something called a chargemaster. It's like a secret menu of prices for every procedure, supply, or medication. But unlike a menu at Chipotle, there's no logic to it. It's not based on cost, it's based on, well, no one really knows. $24 for a single Tylenol, $1,000 for a CT scan that costs the hospital $100 to perform. These inflated sticker prices are how hospitals anchor negotiations with insurers. So, where do these numbers come from? Basically nowhere. Hospitals set their own prices, then negotiate with insurance companies behind closed doors. Depending on who you are, Medicare, private insurance, or uninsured, you could be charged three wildly different amounts for the same thing. Insurance companies agree to pay less, but you still get billed based on those original charges, especially if you haven't hit your deductible. If you have insurance, you might still owe thousands out of pocket. If you don't have insurance, you're charged the full, inflated amount, and good luck negotiating. And even when you do everything right, like going to an in-network ER, surprise billing still happens. Until recently, ERs could bill you for out-of-network doctors who you never even chose. Why hasn't it changed? Because a lot of people profit when it doesn't. Hospitals argue that inflated charges help them cover losses from uninsured patients. But a huge chunk of healthcare spending goes to administrative costs, marketing, and executive compensation, not necessarily better care. And with heavy lobbying, price transparency rules either don't get enforced or don't make it easier to compare. Until we treat patients like informed consumers, with real upfront prices, $6,000 ER visits aren't going anywhere. This is just one example of how the U.S. healthcare system works, or doesn't. Subscribe to Healthcare Digest for weekly breakdowns on policy pricing and the complex world of American healthcare.